This is a patient that was in the first visit when we went back up, when we were able to take our own patients up there. This is a 44-year-old female with the following symptoms: chronic headaches, jaw, facial, neck, shoulder pain, nightmares with some night terrors. And the night terrors would last for 30 or 45 minutes and scare the bejesus out of her husband, which is me. This is my wife. She clenched, she grounded her teeth. She's type A personality. She never sat still. She'd get up 3 a.m. and vacuum the house. I'm going, dang gummit, go to sleep. You're waking me up. But she always had to keep moving. She was a triathlete. She used to work at Parkland in Dallas, and St. Paul's Hospital's in Dallas. And then St. Paul had a swimming pool. So she'd get up at 4 a.m. and go swim 5 miles, then go do a 12-hour shift in a neonatal intensive care unit, come home and run 5 or 6 miles or ride her bicycle 40 miles. She's a hard person to keep up with. But she couldn't sit still because the only time she was breathing was when she was exercising, because she had to inhale deeply. There were times she would come home and my stepdaughters would see her and be with her for 5 minutes, and they were real small, and they'd go to our bedroom and get her running shorts and running shoes and come up, Mommy, you need to go for a run. You know, because when she come back, she wouldn't be agitated. That was the word you hated to hear from her. She was agitated because you're getting ready to move out of the country, because she'd get really upset. But and the other weird thing is she choked really often on her own saliva or on iced tea. The other thing you see with these people that are caffeine junkies, caffeine helps them to breathe. People that are constantly chewing gum, it helps them to breathe. They got habits, oral habits, where pencils or something's in their mouth. They can't get off their cigarettes. They bite their fingernails, pluck their eyelashes. My wife always had nightmares that Steven Seagal was trying to drown her. So I don't know when and where she met Steven, but it didn't work out very well for her.
But it was a breathing thing.
It was a breathing. Yeah. So here's a lateral head film that Dr. Robson took over. And he would do this to every patient. He'd come on in here, how much do you weigh? And the women would just get really upset with him. But he said, well, let's see how tall you are. And he really was more interested in their height. And they'd stand on the little scales and bring the ding down and go, okay, you're 5'8" or whatever. And so here you can see my wife's got a very straight neck. There's no gaps hardly at all between her vertebrae, and there's very little distance between C1 and the base of her skull. And you see this little flying wedge here. That's her hyoid bone. That's what makes us a little bit different than the chimpanzees, because we can use that to speak. But you see, she's standing there. She's not doing anything other than stand as tall and straight as you can. But in standing there, her geniohyoid muscle is compromised or compensating for a lack of airway, and it's contracted so hard you can see density in the muscle itself. Okay. So this is the next day when he seated her appliance. And the bright area just in C1 is her earrings. We've got to take her earrings out. But look how her neck has changed. Look at the gaps between her neck. Look at the distance between C1. Her pain went up. The funny thing she said when they first put it in her mouth was, did you put Valium on this? I mean, she had she went to college on a music scholarship. And she always had this, even while she's falling asleep, her feet got this little weird rhythm, just bugs the crud out of me. As soon as he put that in her mouth, her feet stopped. And my buddy John had the daughter that studied, goes, God, look at her feet, they stopped moving. I mean, it just totally calmed her down. We missed our flight coming home, and I had patients the next morning, and there's only one seat on the next flight. She said, you go catch that. You got patients the next morning, I'll stay here. I got on a plane thinking, there's going to be a mass murder at Seattle Airport, because she never sits still. I get to Dallas. I call her as soon as I got off the plane. How you doing? I'm doing great. I read 2 books. I met the nicest. You read a book? I read 2 books. Oh my gosh. I didn't know you could even read. Because she never read. She never watched TV. She had to be moving. Okay? So, the other thing, she was 3/4 of an inch taller. You take the appliance out of her mouth, you put it in, and she'd hit here. Take the appliance out, she'd just shrink. It was the weirdest thing ever. But the story I tell myself is that when you got her tongue out of her airway, her autonomics now didn't recognize a threat, so she wasn't in fight or flight all the time. Now I can breathe. I don't have a threat to my body. Okay. She verbalized calmness. She had ease in swallowing. Her nightmares went away. Her headaches improved dramatically. And it was all an airway issue. So how does this work? Again, this is the story I tell myself. And one of the stories that Robson told us. He said, what do you do if you find somebody drowning or in an accident? You take CPR. What's the first thing you do if you take CPR? Open the airway. Put them up. Okay. And what do you see with people, older people, as we all age? We lose muscle tone in our throats. We get a forward head posture. We're doing that to help us breathe. This was Robson's theory, and I find it to be very accurate. So what happens if you take your head and move it forward? You've now taken this 16-pound object and stuck it out here. Now you've created a lever. Now this lever has about 25 or 30 pounds of pressure. So you got to keep it from falling into your lap, so everything back here tightens up. Everything in here shuts down. Okay? And so you walk like this, and you have this curved back and forward head posture, and all these muscles in your neck and throat get tight because of this forward head posture. And all you're doing, though, is trying to maintain your airway. And you go, well, I don't understand. Well, there's a great little book called The Anatomy Trains. Okay? And this is the fascia from a cadaver that's been dissected out. And the fascia goes from the tongue down through the lungs and the diaphragm, the quadratus lumborum, the iliopsoas, what are the muscles most commonly causing chronic back pain? The iliopsoas and the quadratus lumborum. Goes all the way down through your adductor groups, through your knee, deep posterior muscles of your leg, ball of your foot, plantar fascias, or plantar surface of your foot, all the way to your big toe. So your tongue affects all the way down to your toe. So how does the tongue? Well, the tongue is the connector to your entire body. It's connected. It is like the rudder of the spine. When it's out of alignment, other body parts can go off kilter and cause issues that seem unrelated.